right, good evening, and this is Care Beyond the Prescription. I'm your host, Dr. Ivan Williams, and today we have a guest with us, none other than Dr. Romain, who will be sharing with us today about men and men's health. Too often, a lot of men come to the hospital when something is broken beyond repair or broken to the point where it affects their income or their family, and that's when they come. However, the concern is, why are men so poor in their health seeking behavior? Why do they wait until it is too late before intervention? So, without any further ado, I would just like to jump straight in. And Dr. Romain, he is a physician for some time now, and I'll just allow him to briefly introduce himself.
Dr. Ivan, thank you for having me on the show.
Not a problem.
I'm Dr. Romain. I've been a general practitioner for a number of years, and over this time period, clearly I've interacted with a lot of male patients, and as Dr. Williams would have alluded to, a lot of these patients who come in, they come in at times when the interventions that we could do and provide as physicians are not sufficient for the challenges that they come in with. And so, yes, it is fitting to see via discussion what may be the cause. And as a disclaimer, this conversation is not purely scientific by data backed evidence, but or evidence backed data, but it's really rooted in our personal experience in our profession.
Right. So, I was mentioning to you earlier that a patient came and they saw me for pain in the chest that radiated down the arm. And this has a lot to do with perception. So I think the first point we're going to address is perception.
Mhm.
One of the reasons why male health seeking behaviors might be so poor would be because of perception. They perceive the problem as small
Mhm.
or minor or not important enough. And in this particular instance that we're describing, this guy saw his problem as being punished by God, that God was punishing him because of some wrongdoing.
Mhm.
So he had chest pain that radiated down the arm. And for those who have some insight, right away you might think that it's a problem with the heart. But he thought that God was punishing him because he was doing wrong things with his left hand. Now, he came because it got so bad.
Mhm.
At this stage, after investigation, we find out that it's a heart attack that he's having.
Okay, for about how long he was getting that pain?
So this pain was there for like at least 2 or 3 days,
Mhm.
and he decided that it's finally too much, too overbearing. The average person would come almost instantly when they have a slight chest pain. And when I say the average person, I'm talking about a woman,
Especially on the left side.
especially on the left side. But this guy decided he's going to come 3 days after. Now, he had to be admitted, hospitalized. Thank God he did not die.
Mm.
But it was so bad looking at the results that it looked like, yeah, he's not going to make it.
Gotcha. Gotcha.
So, perception. What is your take on the perception of men and how they deal with it?
I think the health seeking behaviors in men is driven in large part by how they were socialized. And so, broadly speaking, there are two categories of men who come in. They are the millennials and then they're the premillennials. So, the premillennials, to me, they have a mode of operating that causes them to quote unquote suffer in silence and be as much as they can, uh, as is a manly thing to do based on the socialization of the culture at that time. And it's only when things become so severe that they can't manage without asking for help that they do present. And a lot of times, as we've mentioned before, at that point, it may be that the help that can be given to them may be insufficient for what they have. Yeah.
Right.
And on the flip side, I see millennials and younger who actually adopt better health seeking behaviors, men. So they don't need much to come in. Their threshold for seeking healthcare advice is lower than those men who would have gone before them. What's your experience been like in that regard?
Well, I mean, similarly, you are right in this regard that the younger men seem to be a lot more proactive about their
Mhm.
health and have better health seeking behaviors based on some of the patients I've been seeing over the last few years.
Mhm.
But overall, there is still this pushback from men when it comes to going. In order for a man to come to the hospital or to a doctor's office, the woman brings in his mother, forces in his daughter, his wife, and in that regard, it creates this overall perception again that men don't want to sort out their health,
Mhm.
and even so, when we are looking at other reasons why men refuse to come, when you talk to them, there is a sense of fear,
Mhm.
which brings you to the next point, and that is fear of the
Agreed.
doctors.
Agreed. Agreed.
Some men come and they're afraid.
Uh-huh.
And what happens? The pressure goes up. And they don't want to come to the doctor because the
Yeah.
pressure goes up. And if the pressure goes up, it's going to mean something else. And they don't want to do the examination because it might mean feeling violated. And they don't want to do the test because it's going to mean that you're going to get a negative result.
So there's a built-in anxiety or apprehension for what going to the doctor represents.
Correct.
Not just the first encounter,
Correct.
but
Correct.
possible subsequent follow-through.
Correct.
Mm.
So, how, I mean, we're identifying some of the problems, but how would you suggest we deal with these kinds of problems in terms of a resolution or a solution for a problem?
I think we're seeing resolutions coming to the fore. That essentially is a cultural shift or a societal shift.
Mhm.
So the younger generation, based on where society is now, they are more comfortable. But for the age group that we are talking about in particular, uh, the most that we can do really is continue to bring it to their attention through forums like this and other ventures. But ultimately, it really depends on the individual man to make that decision. All potential anxieties put aside to deal with whatever challenge that they're facing in that moment. But you're right in identifying a lot of men have that level of apprehension. It's also mixed with an ability to not say much. One of the things that I notice commonly with men, let's say 45 and older, is they come in with a lot of foot related issues. And so poor circulation that goes beyond poor circulation, but now we in the setting of infection or the circulation is so bad that there's very minimal blood flow. And so the foot essentially starts to rot.
Yeah.
And it's at this time that a lot of these men present. Interestingly, I don't see as many women, right, coming in, at least in private practice, for these types of issues, right? So by the time this happens, you know that a lot of time has passed. This is not something that happened overnight.
Correct.
You
It was
ask a lot
there.
of men, who do they live with? Do they live by themselves? And a lot of them will tell you no. So you got to understand that ultimately these men make a decision on their own despite the influence around them
Yeah.
to not seek further help for their health.
So speaking of seeking help, um, I mean, I want to speak to the men directly because the education part of things we're talking about, there's a lack of education. And because men don't know exactly what the problem is, or they have an assumption as to how to deal with the problem, they sometimes make decisions that ultimately might lead to their demise. Now, we were talking about fear earlier. A lot of fear is grounded in just lack of facts. When you're confident in what you know, then you don't have to worry. So I'll give you a quick fact. If you have chest pain on this side of your body, on the left side of your chest, and it radiates to your shoulder and it goes down your arm, it is possibly a heart attack. Don't sit down and wait. Come to the doctor urgently. Another one would be if you have urinary tract problems where you're passing urine frequently and you're unable to hold your urine and your stream used to shoot that far and now it's dropping in front of your foot when you pee, it's probably a prostate problem. Don't waste time. Come to the doctor right now. Dr. Romain, give me two other instances where people need to be educated, men, on two conditions. Speak to them.
And I'd point out depressive symptoms.
Mhm.
And so some of the things that you can experience would be withdrawal from the people and events that usually bring pleasure
Mhm.
or that you derive pleasure from. Uh, Change the sleeping patterns, either
Mhm.
sleeping less, you could be sleeping more, change to your ability to concentrate, hold information, focus on a particular task,
Mhm.
more easily distracted, uh, changes to your appetite as well.
Mhm.
Could either be eating more or less. Uh, and if things have been in a state like that for some time, it's also possible to consider suicide. So possibly might not have before, but in those moments, uh, the way to proceed really is not to isolate more or keep the feeling information to yourself,
Mhm.
but really to seek help.
Talk to somebody.
Yeah, yeah. And I realize that there are lots of men who have these symptoms. They don't necessarily present for them, but in speaking to them, you get to understand that there are some things there behind the scenes that get predisposed to this. Another one is hypertension, called the silent killer.
Mhm.
There's only one way to really know that you have high blood pressure or hypertension, and that is to check your blood pressure.
Correct.
All right, with elevated readings on two occasions at least in a controlled, relaxed environment, which that's the official definition of hypertension. With undiagnosed hypertension for an extended period of time,
Mhm.
it puts you at increased risk for stroke. It puts you at increased risk for the same heart attack that you
That's
described.
right. That's right.
Kidney issues where the kidney isn't able to process and filter some of the body's toxins, so to speak, and that could cause a lot of different challenges systemically, not just as a result or not just isolated to the kidneys. And so those are two conditions that I would say men need to pay more attention to.
Right.
Depression under the umbrella of mental health
Mhm.
and hypertension. Yeah.
Correct. Correct. No, I'm glad you brought that up because another very important health issue, male health issue that is ignored many times is sexual health. A lot of men are out there going to the black market and different markets to help them to perform. And the performance that they are getting is apparently very good. So I heard. Some of the stuff that they're taking, whether it be bush or even the medication that we know, I don't know why they get it on the black market, but anyways, they come to the hospital many times and they would have abused or overused it and then now have complications. Again, not everybody should use those medications. There's a label warning that says if you have hypertension, for example, you should talk to your doctors first before using it. Some people are on medications and they're using the medications that have similar effect to the other medication on the black market, and then they come with further complications of the same problems. So sexual health is an important matter to discuss with your doctor, not to skirt around or beat around the bush, because if you don't have it, you might make the wrong diagnosis on yourself first and then take the wrong treatment. Erectile dysfunction and impotence is not the same thing. Two different things, two different categories. And then there's also anxiety related problems with erection. So not because you have anxiety means that you have ED that is related to a physical problem. So it's important to distinguish between the two: sexual health issues, mental health issues, and just regular non-communicable diseases and the type of issues that exist. But one more, what about STDs? Tell me about STDs and men's health.
That is a colorful topic. Right? I've found that a lot of men have, uh, how to put it, a casual relationship with STIs. Yeah, especially the younger population, right? Protection is not something that they necessarily adhere to strictly. A lot of them go off of what they call vibes.
Right.
So they'll be in the moment and they would know that they should use contraception or barrier protection or condom. And they choose not to. And then they show up. Doc, I seeing something. When I look into urinate or I get in an itch and I get pain. And then you talk to them, you ask them, they, tell me what you know about STIs. Look, I don't really know. And it's a little bit surprising given how many advertisements,
Right.
given how serious the topic is from a public health perspective with a lot of health promotion. And so there's readily accessible
And the internet,
material, right?
social media.
But the attitude for whatever it is, isn't one where that level of personal responsibility is adhered to. There are serious risks associated with STIs, not just to you as an individual, but for everyone who's involved, right? Potentially. And there are risks associated with their ability to reproduce in the future. Right? As a man, as a woman as well, if these things go unchecked. There are challenges as well if children are born in that setting with the transmission of particular diseases. So, broadly speaking, there are two main groups of microorganisms for STIs. They are the viral infections, which we would consider the more uh, challenging to manage because they require ongoing management for life.
Yeah.
They don't go away. Those are HIV and herpes simplex. Herpes isn't necessarily one that poses any real threat or danger to your life, but it is an inconvenience in your social life, right? So every so often you might have a flare, and during those moments it becomes transmissible. And HIV is one that has more serious impact to the quality of your life. You're gonna have to be on medications for those for the rest of your life to make sure that the virus is suppressed sufficiently. Because if it isn't controlled, then your ability to fight regular everyday infections from exposure that we go through would be significantly impaired. Bacterial infections, I think this is where the attitude of, I guess, don't care to a certain extent comes in. You go in, you get a shot, you're good to go. All right. No, that's not the approach. The appearance of one STI is associated with the appearance of more STIs. Right. So when there's one, there's more usually. Right. So even though there may be cures for the bacterial infections, STIs, that's a good idea. Use protection.
Indeed, indeed. And I mean, to just summarize and encapsulate everything that you've been saying, every man needs a man.
Wait.
Every
Dr.
man
Williams, I know you're studying.
needs a
Please,
man.
please clarify.
All right. Every man needs a man because not every man knows how to be a man. And a lot of men are born leaders. They will lead. They will take the lead and do things that they shouldn't. End up in risky behaviors, whether it be sexually or even just in life. A lot of men are dying every day, more than women. A lot of men are in prison, more than women. A lot of men end up suffering, even in family situations. Men are almost extinct, I would say. And the reason why is because men don't know how to lead. And men don't know how to lead because they don't have a good example of how to lead. Hence the statement, every man needs a man.
So
So
mentorship way.
in a mentorship way,
Thank you for the clarification.
Mr. in a mentorship way, indeed. So with that said, when you look at leadership, leadership is about being careful in how you delegate responsibilities, in terms of how you show leadership. And when you're in a position of leadership, people are looking at you, so you tend to behave yourself. If a man is a leader and he wants to lead in the right direction and he has that oversight from another leader, you have your leaders to impress, you have the people that are following you to impress, you tend to be a bit more structured and a bit more
Circumspect.
focused.
Mm-hmm.
So if you have a good leader, you're going to do the right thing because people are looking on. You have people to look up to.
Expectations as well.
Exactly. So when you are executing your duties as a man, not just in the leadership sense, but even in everyday things, taking care of your health, taking care of your family, taking care of your finances, if you have that hat on, that leadership hat, you're more likely to be focused, more likely to get the job done because you're driven. So the idea of men's health, coming back to what we're discussing here, and health seeking behavior, is men are not doing that well in the health department. Men are dying every day. Men need help. But as men, we can do differently. As men, we can change the script. As men, we can become the leaders we ought to be by just getting some education, getting the information, understanding how to execute your duties as a man. With that said, I think this brings us to the end of this episode. And in the episodes coming, we want to touch on the different aspects of health. We want to touch on women's health, children's health. And this is still care beyond a prescription. Many things happen outside of a prescription. And we can't ignore those aspects. Your visit with the doctor might be 5, 10, 15 minutes. Doesn't encompass so many things. And that's why we're here to share because we care. I'm Dr. Williams again, your host for Care Beyond Prescription, and thank you for listening.